Let's discuss about today CKMB test. People also call this test as a CPK test. What is CKMB test? This test measures the amount of an isoenzyme of creatinine kinase in your blood. It is called CKMB. Your body makes three forms of CK including CKMB. CK is found in the heart, muscles and other organs. These include the small intestine, brain and uterus. If you have a heart attack, injured heart muscles cells release CKMB into your blood. Because many tissues contain CKMB or CK, high level of CK can be a sign of a variety of problems. Higher CKMB may point more directly to the heart damage. But measuring CKMB used to be a common tool for the diagnosing heart attack. But healthcare providers use it less often today because cardiac troponin. We will discuss in another video full case of a study cardiac troponin. But we come to the main point here. Cardiac troponin is now the blood test of choice for finding a heart attack. This is because cardiac troponin is more specific and more sensitive than CKMB test. So we will definitely make another video with full case study of the troponin test. Why CKMB test is done? A CK test is most often used to diagnose and monitor muscular injuries and disease. These diseases include muscular dystrophy, a rare inherited disease that causes weakness, breakdown and loss of functions of skeletal muscles. It mostly occurs in males. Rhabdomyolysis, a rapid breakdown of muscle tissue. It can be caused by a serious injury, muscle disease or the other disorder. The test can be used to help diagnose a heart attack. Though not very often, CK testing used to be a common test for heart attack. But another test called troponin has been found to be better at detecting heart damage. Why do I need for this test? Or what are the symptoms of CKMB test? Here we go. You may need this test if your doctor thinks you are having a heart attack. Symptoms of a heart attack often include below pain or discomfort in the chest, such as squeezing sensation or feeling of fullness, pain in the neck, back, left arm or jaw, shortness of breath, lightheadedness or dizziness, nausea or vomiting, sudden sweating and tiredness. What are the major causes of increased CKMB level? Certain conditions and injuries that are not directly related but affect you. Hormonal disorder such as thyroid disease, Addison's disease or Cushing syndrome. Prolonged surgeries, seizures, infections, lumps and rheumatoid arthritis, celiac disease, kidney failure, high fever accompanied by shivering, a blood clot, any drug or toxin that interferes with muscle energy production or increase energy requirements, short injections, connective tissues disorder. Now let's discuss if you see your result of the CKMB test. So you don't know how to read, how to understand. So here we are going to help you. So what do my test result mean for me? Test result may vary depending on your age, gender, health history and other things. Your test result may be different depending on the lab what lab used. They may not mean you have a problem. Ask your doctor what your test result mean for you or the laboratory technician. Levels of CKMB do not rise in your blood within the first 4 to 6 hours after the heart attack. You may need to have repeated tests to see if you have had a heart attack or not. Higher level of CKMB may mean that you have had a heart attack or have other heart problems. Here, these include below. First, myocarditis. This is an infection and inflammation of the heart muscle. Pericarditis. This is an infection and inflammation of the thin sac that surrounds the heart. Higher levels of CKMB may also mean more of the heart was damaged in the attack. Higher levels may also be caused by muscle damage elsewhere in your body, by diseases that affect your muscles, and by trauma to your chest. Below we have mentioned the CKMB range from 3 to 5. This is a normal range percentage of total CK or 5 to 25 IU/L. You can check your report according to your age, gender, and the percentage area mentioned and the range. You can check this thing in your report self. Thank you very much for watching the videos.